I'm Dr. Michael L. Johnson. I'm a board-certified chiropractic neurologist, and we are on video number 54. We're going to talk about insulin potentiated therapy. I do not use IPT, insulin potentiated therapy, in my office. I'm not allowed to. Insulin is a drug. And what IPT is the non-diabetic use of the hormone insulin. But I want to give you as much information as possible. You or someone you know has cancer. This is life and death. I want to lay out every option there is. Research has shown that most cancer cells have as many as 10 to 15 times more insulin receptors on their surface than normal healthy cells. With insulin present, these receptors open cell wall channels which allow nutrients to enter the cell. As cancer cells have far more of these receptors than normal cells, they can strongly compete with normal cells for many nutrients. When insulin is administered to a patient prior to chemotherapy, it opens the receptor channels of both the cancer cell as well as the normal cell. As a cancer cell can absorb over 10 times the amount of normal cell, only a small dose of chemotherapy needs to be used, usually 10% of the typical amount, with IPT. And there are clinics around the country that use IPT, insulin potentiated therapy. I want to give you every option out there, folks. The normal cell will be relatively unaffected by the small dose of chemotherapeutic drugs. Not so with cancer cells, they are destroyed. See, when my mom had cancer, I wanted to know all the options. That's why I got a computer. And there wasn't anywhere near the information there is out there now. Is it right for you? It may or may not be. But I want to give you those options. You know, there's a few things now we've talked about, IPT and other things, that I don't necessarily do in my office. And some aren't even allowed in the United States because this video does go worldwide. It's the World Wide Web. But it allows for options for others out there, for them to decide. Give them the information and let the patient decide, but always do what's in the best interest of the patient. I'm Dr. Johnson. If you have questions, email me, mljohnson@askdrjohnson.com.